Hello everyone, in this video we are going to discuss about the branches of external carotid artery. First coming to the anterior branches. The anterior branches are facial artery, lingual artery and superior thyroid artery. And the posterior branches are posterior auricular artery and the occipital artery. The medial branches ascending pharyngeal artery and the terminal branches are superficial temporal and maxillary artery. So what are the areas which these supply? The superior thyroid, as the name suggests, it will supply the thyroid gland, larynx, infrathyroid muscles and sternocleidomastoid. So main thing is the thyroid. Ascending pharyngeal, as the name suggests, it will supply mainly pharynx, prevertebral muscles, middle ear and meninges. Lingual artery will supply tongue, lingual, tongue, floor of the mouth and sublingual gland. Facial artery will supply the face including the lips, nose, medial eye, submandibular gland, tonsils and palate. Occipital artery, as it is a posterior branch, it will supply the posterior scalp, sternocleidomastoid and deep muscles of the neck. Posterior auricular, it is also a posterior branch. It will supply the auricle, scalp posterior to the ear, middle ear and the inner ear. Next, maxillary artery, it will supply the deep face and maxilla, mandible, nasal artery, nasal cavity, dura mater, teeth, muscles of mastication. Superficial temporal artery, it will supply the scalp in the temporal region, face and auricle. So for main things we can remember is superior thyroid will supply the thyroid gland, ascending pharyngeal, the pharynx, lingual, sublingual gland and the tongue, facial, face, superficial face, submandibular gland, occipital, posterior scalp, posterior auricle, scalp posteriorly and maxillary artery, deep face, superficial temporal artery, scalp in the temporal region. So we can easily remember these branches by the mnemonic of salt palms. Like we can remember like sprinkling salt and pomegranate on the face. Like SAL stands for superior thyroid artery, ascending pharyngeal artery, lingual artery. POMS stands for posterior auricular artery, occipital artery, maxillary artery and superficial temporal artery. And face, F stands for facial artery, or we can generally remember by the mnemonic flap mass.